Good afternoon. Happy Friday. Thank you, everybody, for tuning in, and thank you to everybody for your flexibility. We had to change the schedule this week to Friday. I have been in quarantine until today. I want you to know I've tested negative every single day for the past week and a half. I feel terrific, and I want to start by saying thank you. There have been so many well-wishers to me and my family as I've been in quarantine, so thank you. Thank you for your kindness. I also want to report that Dr. Alexander Scott, who did test positive, is at home today. She is asymptomatic, feeling fine, and working hard from home. She continues to be amazing and hardworking, so I want to thank her and also reassure you that she's doing well. We have Dr. McDonald here with us today to fill in for Dr. Alexander Scott. He is fantastic and no stranger, and I'm delighted to have him with us today. And I'm also joined again this afternoon by Dr. Chan, who is taking the lead on our vaccine distribution, the most exciting part of these press conferences, and I will be turning it over to him as well to give us the vaccine update. Next week, the press conference will be on Tuesday at 1 o'clock in honor of Christmas Eve, which is on Thursday, and of course, Christmas Day on Friday. And then the week of Christmas and New Year's, there'll be no press conference, and then we'll be right back here Thursday, January 7th. Okay, today we'll begin as we always do with the data, and if you could please put that on the screen. You'll notice some very good and exciting news on the dashboard in front of you, which is that we actually have included a category now for vaccines. First time we've done that. As part of the dashboard, we're going to include the number of vaccine doses that we have administered. So that, for me, is fantastic and thrilling and a relief that we've begun the vaccination process. And as I said, Dr. Chan will talk more about that. Yesterday, we had 395 new cases out of a total of 9,000 tests for a test positivity of 4.4%. Obviously, the number of tests was down yesterday on account of the storm, but 4.4% positivity is good news. That is good news. A couple weeks ago, we were at 10%, and now we're at 4.4%. So we're certainly headed in the right direction. Not good news, and I say with a heavy heart, we have another 23 deaths yesterday. After a few months of numbers ticking up week after week, we're starting to see our numbers turn around and begin to trend in the right direction. You'll see the data reflected in the dashboard in front of you. For the first time in over 2 months, all 3 arrows are pointing down. That's a big deal. For the first time in 2 months, all 3 arrows are pointing down. Percent positive last week was down to 7.8% from the previous week of 9%. New cases were down from 850 to 790, and new hospitalizations have essentially leveled off. If you look at the numbers today and over the last few days, you see it isn't a fluke, and it's a trend for the past week or so. And frankly, we know why that is. It's because we hit the pause button and Rhode Islanders listened and were fantastic through the pause. So I want to say thank you. As I mentioned last week, around November 25th, which was right before we hit the pause button, we saw mobility begin to decrease. But in the period of the pause, we've seen a real decline in mobility. People are just not out and about as much. Our R value, something we haven't talked about in a long time, but the rate of spread has been steadily decreasing since we started the pause, and it's now about 1. So each person is infecting 1 other person. We had been in a place where each person was infecting 2 or 3 other people. So that's all good news. So as a result, because people listened to the pause and took it seriously, today I'm announcing that the pause will end on Monday. The pause will end on Monday. I would just say, for those of you who struggled during the pause, gyms were closed, bars were closed. I want to thank you. I know it's been a sacrifice. That's why we put financial aid right out the door to you. But it was a necessary thing to do, and it's effective. Our hospitalizations have leveled off, which is exactly what we were trying to accomplish. I told you we would keep it in place for as few days as possible, and we would lift it the minute that we could. It's been 3 weeks, and it'll be lifted on Monday. Please put up the slide, a bit more evidence of the fact that the pause is working. It's a slide that shows how our percent positive has been moving. It shows the percent positive in Rhode Island over the past 3 months. And you can see that after 2 months of really steep growth, the numbers leveled off around December 2nd and have been in steady decline ever since. So when I was here a week ago, we had started to see a slight decrease in percent positivity, and I said I was hopeful at that point. Today, I'm relieved and pleased that the decline has continued. And so now that we are more than a week into sustained decreases in percent positivity, and we're seeing a leveling off of hospitalizations, it's clear that your cooperation with the pause has saved lives and enabled us to get control of our situation. A month ago, I stressed we were at risk of completely overwhelming our hospital system by the end of the year, but that is no longer a risk because of the pause. And I was briefed yesterday on what's happening in Los Angeles, San Diego, Southern California. They're out of ICU beds, can't get one. Thank God that is not the case in Rhode Island. Our hospitals are stretched, and we're operating 2 field hospitals, but because of the pause and because you took action, we're in a more stable place. So I wanted to thank you for that and share where we are. Having said that, as I've said from the beginning, we can't just flick the light. I think we're going to go from here. So I'd ask you to please put that slide up. On your screen now is a slide showing the trajectory of hospitalizations, as well as 3 projections of where in front of you. That shows what our model predicted if we hadn't done the pause. As you can see, the line just continues. It's a straight line up, reaching 800 hospitalizations by the end of the year. That would have been a level of hospitalizations we could not have staffed, and it would have been very dangerous. Thankfully, we're not going to get there because we did the pause. In the blue is what the model shows, the effect of lifting the pause Monday and immediately going right back to where we were pre-pause. And you can see the effect of that, and that is not a good path. Risks overwhelming the hospital system next year. And so that's why we believe we have to have a slow dial-up, which is the purple path, the purple line on your screen. The purple line on your screen models a 3-week pause, which we've been through, followed by a slow dial-up of the economy, which is what we will begin on Monday. And clearly, as you can see, the purple line is the best outcome. It allows us to turn the dial up on the economy and get people back to work, a little more leeway for restaurants, gyms can open again. You can go back out to the gym, etc. But our hospitals don't get overwhelmed. So the slide before you is meant to share with you how we're thinking about it. No decision is perfect, no decision is easy, but we don't want to overwhelm our hospitals. We never want to get to a place where we have to turn people away and we have no ICU beds. So we're going to pursue the path that I laid out a few weeks ago. We're going to end the pause on Monday. We're going to slowly start to dial up our economy. And all of the new rules around restrictions can be found right now on reopeningri.com. So if you can go to reopeningri.com, it lays out all the new rules which start on Monday, and there's a question and answer section in case you have questions. I will say there's nothing new there, though. This is exactly what I forecasted a week ago. The news for today is making it official. Pause ends Sunday, reopening begins Monday, and again, it's a slow dial up, so we hit that purple line. I will say this. There is no certainty, there's no pure certainty around exactly where we go from here. And it depends on some factors. So how we all behave over the holidays is a huge factor. If we all have large social gatherings without masks on, crowding around the Christmas table without masks on, big family gatherings, if we travel a lot, then we're going to get into trouble again, and we may have to go back to a pause. On the other hand, the vaccination rollout is a good thing, and that is in our favor. So hopefully that might enable us to do even better than that purple line. And we won't know for sure for some time what impacts the factors will have, but what we have to do now is focus on what is in our control. And that is the key. The name of the game now is protect your household, stick with your household. That is the key. Continue to limit your social gatherings to your household. If you want to go Christmas shopping or shopping, great, go, wear your mask, go alone or with the people you live with. If you want to go out to dinner, great, with the people that you live with. So there's a lot that's out of our control right now, but there's some things that are within our control, whether we wear our masks and whether we stay with the people we live with. And so that's what I'm asking us to do to protect our household through the holiday season, which, by the way, includes Christmas. And that's hard. That is a hard message for me to deliver. It's a hard message for me to deliver to my family, my friends, and the people of Rhode Island. I had to deliver that message for Easter and Passover and all of our Thanksgiving, all of our holidays. And we had hoped that Christmas would be different, but unfortunately we are where we are. So we're all gonna have to reinvent our family traditions this Christmas. And I'm asking you, please, to celebrate with the people that you live with. And bear in mind that outside is much safer than inside. And of course, you wanna be wearing your masks. And again, I'm asking you, the best thing we can do to protect our household in the coming weeks is to limit our social interactions with the people that we live with. So try not to travel to see people. Don't host a big party at your house. It's hard to hear. Things will be different. I promise you next Christmas will be better, and we can have all of our family over, and New Year's Eve will be better and we can have everybody over. But this year, I'm asking you, please try to keep it local, keep it small, hang out with the people that you live with, keep it outside, and wear your masks. I also want to thank all of our faith leaders for your exceptional leadership, collaboration, and partnership. I know this is a very important time of year with Christmas and Hanukkah and year-end celebrations. I understand as a Christian myself, Catholic myself, the solemnity of Christmas Eve and Christmas Day. I want to recognize the Catholic Church. They have said there will be no midnight mass at the cathedral this year. That is a big step, and I want to thank you for your leadership. There'll be no midnight mass at the cathedral. There will be extra masses on Christmas Eve and Christmas Day so that people can spread out. All of the faith leaders are going out of their way to keep their parishioners safe. More services, virtual services. I can't thank you guys enough. You've been outstanding partners, and God bless all of you. Next year, I hope we can fill the cathedral for Christmas Eve and Christmas Day and all the other places of worship around Rhode Island. Now, in addition to staying with your household, the other thing you can do to protect your household is to go get tested. I want everybody to go out and get tested. Get tested next week, and then get tested the week after that. Just go ahead and do it. Getting tested is simple, incredibly effective, free, and will protect your household. We're making it easier. I know a month or two ago, there were lines for testing. Some people were getting frustrated that they were having to pay. It's a different story now. And I'm asking you to please go get tested. You won't have to wait in line. It won't cost you anything. It's easy. You won't have to give any information that you don't want to. It's safe. It's one of the simplest things you can do to protect your household. So over the last month, we've made a lot of changes. And as a result, everybody in Rhode Island can go get tested for free. You can schedule your own test at portal.ri.gov. Portal.ri.gov. It doesn't matter if you have symptoms or not. If you have symptoms, you definitely should get tested. If you don't have symptoms, you ought to go get tested. It doesn't matter what community you live in, what you do for a profession, how old you are. We really are asking everybody to go get tested. In the past week alone, we have increased capacity at the Wickford train station. So if that's convenient for you, we have a lot of capacity at the Wickford train station. Stop and Shop locations in Cumberland and Newport. We opened a test site just today in North Providence at the old public safety complex, classic Rhode Island, the old public safety complex in North Providence. Go there and get tested. We've continued to ramp up capacity at the Dunk. Go to the Dunk. Go to the Dunk. It's for those of you who don't love driving into Providence, I'm going to tell you there's free parking. There's no line. We have capacity to do 5,000 tests a day. We're doing 500 tests a day. So come on down to the Dunk and get tested. You'll be in and out in 15 minutes, 20 minutes. That's what people are reporting. You can get a same-day appointment. Just please go ahead. And by the way, get it done next week and the week after and the week after. In an ideal world, we'd all be getting tested once a week, once every 10 days. Especially if you are planning to travel over the holiday or get together with folks, which I hope you don't, but absolutely, if you are going to be doing that, get tested before and get tested after. If you're going to go to church, if you're going to do Christmas shopping, hopefully you get the gist. Just go get tested. To make it even easier for you, we're going to try to meet people where they are in the next week. So starting now, we are launching a very aggressive in the community holiday testing strategy, and we're going to be setting up pop-up sites all around the state. We want to make this super easy. We're going to go where we think you will be. So we'll be at the mall. We're going to try. So by the way, I'm saying this because if you're going to go out and do your Christmas shopping, or if you're going to be going to church or doing grocery shopping or et cetera, you're probably going to see a testing table. Don't be alarmed by that. That's for you. It's free. It's easy. Get a test. You'll have a result right there in 15 minutes. Simple, easy, free thing to do that protects your family. So don't be surprised if you go to the Warwick Mall or Garden City or Roger Williams Zoo for the drive-through lights display and you're offered a test. I'd ask you to do it. Do it. I've done it dozens of times. It's not going to hurt. You'll have a quick answer right there. And then if you're positive, you'll know you have to go stay at home and isolate. It'll protect you and protect your family. So this weekend, we're going to be at malls, retail stores, gyms, grocery stores, senior high-rises, big apartment buildings, churches. We want to meet people where they are. We'll be at Stop and Shops. We'll be at the Arcade in Providence. We'll be at Chapel View in Cranston, the Warwick Mall, Farm Fresh, Rhode Island. There's going to be a full list of these sites on the Department of Health's website. So if you're eager to know where they are, go to the Department of Health and you'll see the list. But otherwise, as you're out and about doing what you need to do with people you live with the mask on, go ahead and get a test. Add 15 minutes to your shopping trip. If you are a retailer or a business and you're hearing me say this, and you would like to become a pop-up testing location, we'd love to have you. You can go to info@commerceri.com, info@commerceri.com, and we'll happily see if we can set up a site there. By the way, all of these pop-up testing sites are free. You don't need an appointment. So as I said, I can't say it enough. Our goal is to perform more than 20,000 tests with these pop-up community sites, which are going to be open starting this weekend. And I hope it provides you with peace of mind, and it's something that it costs nothing and it could save a life. Okay, in addition to the holiday testing, we're also launching another targeted testing effort for schools when the kids return to school in January. Earlier this week, we announced an updated school calendar, giving school leaders some flexibility next week and the opportunity for a ramp up to full in-person in January. We expect all schools to begin bringing the kids back by January 7th, and we want everybody back in person by the 15th. That's an approach that worked well in the fall. Now, there'll be many schools, public, private, parochial, that'll be ready on January 7th to take all the kids back. And that's great if you're ready. But we also know it's not easy, so that we're allowing for a ramp-up period between the 7th and the 15th. The Education Command Center is working around the clock to ensure every school has the resources that you need for January, including they're going to be distributing over 6,000 HEPA filters and helping schools implement the Department of Health's guidance. So, it'll be a heavy lift, as it has been from the beginning. And I want to thank teachers, school leaders, superintendents, custodians at these schools. Thank you all so much for your incredibly hard work in doing all that it has taken to educate our kids through coronavirus. And as we look to January and the ramp up, we want to support you in every way that we can to make sure that the kids can get back in January. To that end, we're going to be incorporating much more testing of students and teachers in January when we reopen. We have heard a lot, particularly from teachers, around the desire to have just regular asymptomatic testing. And we heard you, and we're going to deliver. In January, we're really going to ramp up in-school testing of teachers and students on a regular basis, even if you don't have symptoms. And that's going to be in addition to the K through 12 testing line, which has been working very well. But we're going to be starting to, in January, we're going to be using the Binax tests, which are just the kits, no equipment. It gives you a result in 15 minutes throughout our schools. We've started piloting this to great effect over the past few weeks. We've done pilots in Providence, Lincoln, Central Falls, and South County around testing entire schools. And so far, it's been a huge success. Central Falls was the first community to launch the pilot. They've seen a positivity rate of about 1% in schools. Great news. And most encouraging is that after help from the Department of Health and the EDOC, these schools are starting to do additional testing on their own. In the three schools, they've managed by themselves, they've done it all on their own in Central Falls, they've tested over 300 people and had only 2 test positive. So that's fantastic. I have to say, I have to pause for a minute to thank the Central Falls Superintendent, Dr. Stephanie Downey Toledo, who has done just a phenomenal job in getting the kids, and the faculty to the facilities to get tested. And she's also talking to her peers around the state to help them replicate what has happened there. So there's 2 pieces of good news in that. One is, I've been up here week after week, month after month, saying it's safe to be in school. That this is very clear data, even in Central Falls, which is very dense and has the wide community spread. In the schools, in the communities, it's 1%. Secondly, help's on the way. We're going to get out there in January and do what we've done in Central Falls across the state. Much more testing on a regular basis of everybody, teachers and students in the buildings. So we've reached out to all of our district leaders with options for single-day, wide-scale testing events, like a big testing event of the whole school, or regular testing where students and staff are tested in school on an ongoing basis. I want to thank superintendents. It's been a great response over the past 10 days. 10 districts have opted for a testing event where we take the day and test everyone in the school. 10 districts opted for the regular testing every week, and 21 districts opted for both. That's the best news. So I'm excited. I'm excited for this. Our goal is to use 30,000 tests every week in our schools, and that's starting in January, and that's on top of all the other tests that we'll be doing at the testing sites. So we're going to be starting as soon as the spring semester begins in January, and the high density communities, Central Falls, Providence, Pawtucket, will be at the top of the list. So I know it's been a really, really tough semester. Again, I want to thank teachers, students, parents, superintendents, and principals. I hope that this testing gives teachers and parents and students a little more peace of mind that starting in January, we're going to have regular testing on site, rapid results, much more widespread. Finally, one more announcement today relates to nursing homes, another group that has been hardest hit throughout this crisis. I have been asked at this press conference several times about essential caregivers in nursing homes, and I would like to address that today. This week, we gave nursing homes the green light to allow essential caregivers to take care of residents. So essentially family members. So if you have a family member in a nursing home who needs help with grooming, bathing, eating, etc., you as a family member can sign up to be an essential caregiver to your loved one. It's an initiative that has been happening in a number of other states. The Department of Health has looked into it extensively, and they've just given the green light to nursing homes to do this. Now, I want to emphasize, this is up to the nursing home. We are not forcing this on any nursing home. Nursing homes have their hands full, and we want to be supportive. However, it's a path to allow family members to visit safely and take care of their loved ones. Any essential caregiver, anyone who gets qualified as an essential caregiver, has to go through a training program run by the nursing home, and of course is going to be bound by the same testing, screening, and other COVID requirements of nursing home staff. And the good news is that now that we're really ramping up our testing, we're going to have the capacity to test everybody regularly who steps foot in a nursing home. So as we end the year, I know this time of social distancing with restricted visitation at homes has been a huge stress on families, on residents, on staff, and I hope that this does a little something to ease the pain on you and your loved ones. And that's going to begin on Monday, and the Department of Health has today green-lighted this as a program. So with that, I'm going to turn it over to Dr. Chan to talk about the vaccines, and then he'll turn it over to Dr. McDonald to give a broader update, and then we'll take your questions.
So good afternoon. Thank you for those updates, Governor. Today I'm going to give a brief overview of where things stand with our vaccination efforts. I'm incredibly pleased to report that this has been an enormously successful first week in terms of vaccination. We're in an unprecedented moment, as we all know. That term has been used a number of times, holds true, and Rhode Island is really responding in an unprecedented way. I'm personally humbled by the amount of coordination and work that has happened throughout the state to get this life-saving vaccine into the arms of the people on the front lines. Make no mistake about it. Today, this week, is a historic moment towards getting to the end of the pandemic. We have a lot of work ahead of us to make sure that we get the vaccine out to Rhode Islanders quickly and in an equitable manner, especially as more vaccine comes into the state. I'm going to give a few updates on that in a second. But if our state was a runner and this was a track race, right, I would say that we got a fantastic push off the starting blocks these first 4 or 5 days. The teams at Care New England and Lifespan deserve a lot of credit, and I really want to acknowledge them. I want to thank again my healthcare colleagues on the front lines for their dedication and work. I know that these times continue to be really tough. I also want to thank my colleagues throughout state government, here in the Department of Health and throughout the rest of government. Many people, more people than I can name here, work through nights and weekends and continue to do so to get us to a place where we are. You all deserve a huge thanks, so thank you if you're listening. To give you a sense of where things stand, to date we have 9,750 doses of vaccine that have been received by the state of Rhode Island, so 9,750. Approximately 2,000 doses have gone to Rhode Island Hospital. Merriam Hospital and Newport Hospital have each received roughly 1,000 doses. Approximately 2,000 doses have gone to 2 Care New England hospitals, 1,000 to Kent Hospital, 1,000 to Women and Infants Hospital. The rest of the vaccines have gone to South County, Landmark, Roger Williams Hospital, and Fatima. Also, some of our other partners have received vaccine as well, and this includes Westerly and Eleanor Slater yesterday and today. So we're thrilled that all the hospitals in the state have been starting to vaccinate. Again, I really do believe this is the beginning of the end of the pandemic. I do want to highlight that the Department of Health ourselves are not giving out the vaccine. We left this to the hospitals. We don't have staff at the Department of Health. The hospitals are stepping up in these early stages, and we'll be setting up more sites, as I'm going to talk about in a second. To date, approximately 1,226 frontline healthcare workers, as of this morning, have received first doses at these hospital facilities. Thankfully, our shipments yesterday, which accounted for half of the 9,750 doses we received this week, were not affected by the storm. I think that's an important point as we think about the number 1,200-ish who have been vaccinated, is that half the doses just got into our state yesterday. So something to keep in mind as we work through the logistics here. For the week starting December 21st, we expect to receive 6,825 doses of the Pfizer vaccine. We'll talk a little bit more about that in a moment. Also this week, if the Moderna vaccine is deemed safe during its federal safety review process, which is ongoing as we speak, another landmark in the vaccine development, we expect to start receiving doses of that vaccine next week. We're anticipating approximately 19,000 doses of the Moderna vaccine next week, should all the safety approval process be reviewed and approved. In terms of our priority populations, right now we are slated to start vaccinating in nursing homes on December 28th. December 28th. As I mentioned last week, CVS and Walgreens entered into a partnership with the federal government to vaccinate staff and residents in all of Rhode Island's nursing homes. This is a priority population, as the governor mentioned. This setting has been incredibly hard hit by the pandemic. And so we're excited that they can be part of our efforts here as part of phase 1A. This agreement between CVS, Walgreens, the federal government requires us, before we start vaccinating in that setting, to have enough vaccine to allocate. And so that will happen by December 28th is when we start that vaccination project. So this is happening quickly and efficiently in facilities without us having to start and stop, et cetera. In Rhode Island, we also know to have a very high percentage of our population living in nursing homes. So it's going to take us a few extra days to get the vaccine needed to start. And this is compared to some other states which may be starting a few days earlier. Rhode Island is going to take a few more days to get up to speed to be able to vaccinate our populations. But the good news is that residents and workers in nursing homes should all have their first doses within 3 weeks of us starting. So it's exciting, mid-January, which is right around the corner. Vaccination is slated to arrive at assisting living facilities and group homes, and that will begin shortly after the nursing home effort. Something else we're planning that I just wanted to talk about for a few minutes are 5 regional clinics throughout the state that will be opening up in the near future for EMS workers, for home health workers, hospice workers, and as soon as we have enough vaccine and our municipal partners are able to do so, other first responders. So this is a high priority for us. It's coming. The clinics are tentatively scheduled to start the week of the 28th. So December 28th, we expect to open these 5 regional clinics. So thank you again, everyone, for your patience. We're getting a lot of questions, which is fantastic. A little bit longer, and we'll be able to start. And finally, I do want to mention that we're doing we're going to begin vaccinating staff at federally qualified health centers and people who live in Central Falls specifically. This is because of the very high rates of COVID-19 in the community. We've seen that for months. We want to get this vaccine out to communities that are most in need of it. Importantly, we're still finalizing our final phasing plan for who will get vaccinated, where, and by whom. We plan to share this as soon as it is ready, and we'll continue to provide you with updates and reasons why, and the information that influences these decisions. And so this information includes other COVID vaccines. We're very hopeful that new vaccines will be approved that will come in the near future. We know that AstraZeneca has one in development. We know that Johnson & Johnson. So we're very optimistic that other vaccines will be here in the very near future. We also know that our amounts of vaccines supplied to us by the federal government can change. So these are all factors that are rapidly evolving, and we again thank everyone for their patience. A couple last points here. We've received a tremendous number of calls and emails over the last few days here at the Department of Health asking to get on a wait list to be vaccinated. So thank you again all for reaching out. That's what we're here for. We are approaching this in a structured way with a focus on getting vaccine to people who are most at risk. And we've talked a little bit about those populations. As more vaccine becomes available, we will be making announcements daily, weekly if needed, about who and where people can get vaccinated. So stay tuned, check our website, pay attention to these press conferences. We'll be announcing some of that in the near future. We know that people are very eager to get vaccinated. And by the way, I'm very optimistic and I love the demand that we've seen for the vaccine. This is fantastic. This is what we want from public health as a physician. It makes me super excited. So thank you everyone for your patience. A little bit longer here. We're working as quickly as we can. And on that end, and as we tell ourselves that we need to be patient too, many of you saw in the news yesterday that our weekly allotment of Pfizer vaccine for the next week is going to be several thousand doses smaller than what we anticipated. So obviously somewhat disappointing. We're not sure of the exact reason for this. Many other states also saw their weekly allotment reduced. We are in constant contact with our federal partners at the national level to get a better understanding of the situation, and we don't have any answers about the why at this time. In the meantime, we're doing what we've done throughout the pandemic, which is what all of you have also done. We're adapting, we're being nimble and flexible and adjusting to circumstances as they change. And as everyone knows, that's really been one of the themes of this pandemic. In closing, and I just want to go back to my running analogy, the pandemic has truly been a marathon. I think that we would all agree with that. And I think we still have a little bit of ways to go, but I remain optimistic that there is a light at the end of the tunnels. I believe these vaccines are going to come. As the governor presented today, it appears things have stabilized. This is good news with the vaccine. Hopefully this is one big step closer to the end of the pandemic. I'm also reminded that for marathons, the toughest time of a marathon is really at the end. So I think we're getting there. I know it's challenging for everyone out there. Thank you again for your patience and diligence. We're getting through it together. And I know this continues to be a tough time for so many people. So thank you again. So with that, I'm going to hand it over to my friend and colleague, Dr. Jim McDonald.
Well, good afternoon, Rhode Island and beyond. It's fun to be back with you. I do enjoy our chats we have when we do this. Yeah, obviously the vaccine's a big game changer. I'm excited about it as well. I do want to draw your attention, though, to monoclonal antibodies as well. You know, one of the concepts that's really ingrained in medical school is if you're going to order a test, whatever a test might be, what are you going to do with the result? And I think when we think about testing, we talk a lot about testing. Testing's important because we can do case finding. We want to find the folks that are positive. That's why it's so important to do that surveillance testing the governor spoke about, because then we want to isolate folks so you're not infecting other people. We want to quarantine the close contacts. But something changed a few weeks ago with testing, and I'm just not sure that message was out there loud and clear. And I just want to bring you back to one of the earliest times the governor gave a press conference. He talked about, you know, we have to slow things down until we get treatment or a vaccine. Well, we actually have both right now. We have a treatment. And I want to spend a moment or two talking about the monoclonal antibody treatment. So President Trump got the Regeneron product. Other people have gotten the Lilly product. They have long names. I don't even bother trying to pronounce them anymore. But monoclonal antibodies are kind of like an instant immune system. They're made in a laboratory. They're infused through an intravenous catheter. If you're wondering what an intravenous catheter is, an IV, just put a little needle in your hand and one of your veins or your arm, and then you sit in a chair. You sit there for an hour. They just infuse it slowly. You don't feel it going in. It takes about an hour. Then they watch you for an hour longer to make sure you handle the medicine okay. There's a limited supply in the United States of this monoclonal antibody, but Rhode Island's been very fortunate in getting what we're getting. So, my thanks go out to Lifespan. They've done a great job. Dr. Cunha over at Lifespan's done a great job of setting up an infusion clinic. He's an infectious disease expert, done a great job with that. Dr. Erica Hardy did a great job at Care New England getting an infusion clinic together going. So we have a treatment now. And why having a treatment is really important is I really do want to keep you out of the hospital. I mean, I'd love to not have you have this disease, but I want to keep you out of the hospital. And I want to keep you healthy, right? But this is a treatment. This treatment, though, works best if it's given soon in the course of your illness. In other words, if you got so sick you end up in the hospital, the data shows it's too late. The medicine's not going to help you. So I really need to find you early in this. So if you get a test, I have limited supply, right? So what we've done is if you're over 65 and you have symptoms, or you're below 65 and have some of those chronic health conditions that we talked about that put you at risk, I want you to talk to your doctor or healthcare provider about whether or not you qualify for monoclonal antibodies. We've had numerous continuing medical education classes with the doctors. Just so you guys know, we've been doing CME classes with the doctors every other week in Rhode Island, which is pretty cool. We're trying to keep the medical community as up to date. So doctors know this is out there. We have a website that doctors can easily access. They get the referral form. Your doctor can set you up for this. Now, an ID doctor at one of these sites will look at it and make sure you qualify, because this was approved by an emergency use authorization. So monoclonal antibodies are in short supply, but I want to get it to the high-risk people. Nursing home residents, we've got a special allotment for them. People who live in high-density communities, in particular, I want you to think about that. Like, I don't want to spread this to my family, right? So this is out there as a treatment, and I want to throw that out there to you as an idea. So monoclonal antibodies are important, and I want to keep that in the back of your mind. I want to just talk a little bit about testing. I want to talk about my testing experience. So I got tested Tuesday night. And if you're wondering why I got tested Tuesday night, it was because I was coming here today. I wasn't exposed, but I just said to myself, gosh, if I was a journalist, I'd ask Dr. McDonald, have you been tested lately? Because the director got picked up on surveillance, right? And the director was feeling fine. She's just doing the right thing. She's a great example to me all the time. You know, she's one of the smartest, kindest, just good people I know. And she's doing this weekly testing. So I'm thinking like, you know, I better go get my weekly testing done. So Tuesday night, I'm going to get myself set up for a test, right? So I get up early Tuesday morning because I wake up every morning really early. It's just part of me. I'm up early every day, right? So I get on portal.ri.gov like anybody else would. I look for testing sites. I see there's Wickford Station. I live right next to Wickford Station. So I look, there's availability the same day. There's availability between 5 and 6. So my day was Tuesday, but I had no appointments between 5 and 5:15 at night. And I'm thinking like, why not? Yeah, let's just see if this works, right? So it's at a for a test. I leave my house at 2 minutes to 5 Tuesday night. I left my house. Now I had a conference call at 5:15. So I was back in my house at 5:14 doing that conference call. So that was pretty cool. So then Wednesday, I'm just going about my day, and Wednesday night I get a text saying my results are available in portal.ri.gov/results. I'm thinking like, okay, this is pretty, I'm liking this, right? So I get on the website, get my results, I found out I'm negative. All I'm saying is it worked pretty easily. Why not do this once every week or so? You know, I'm just saying it didn't cost me any money, didn't cost me any time, really. I don't know, it gave me a lot of peace of mind. What was interesting was Gail and the kids, they knew Dad was getting tested. Everybody was pretty calm when they realized I was negative. And I just thought that was interesting. I didn't see that coming. A little bit of family reassurance knowing this isn't in the house. So more people in the family are getting tested. So I just think I want to throw out there as a little endorsement. I want to touch a little bit though on Christmas before I wrap up a little bit. So a week from today is Christmas. And just so you know, as a kid, I loved Christmas. As a dad, you have no idea how much I love Christmas. This is huge to me, right? I love getting together with the family. I love doing it. But I want to talk to you a little bit about the McDonald family Christmas of 2020. Here's what we got planned, all right? So, simpler Christmas this year, right? I got 5 brothers. Mom and dad are up in upstate New York. We get together. There's 26 of us. We have a good old time. I mean, my family knows how to family, all right? Christmas Day, what I'm going to be doing is I'm going to do a little portal conversation with my mom and dad. We'll have a good old visit on the portal. I have 5 brothers. I'll portal with all their families. We'll have a great time. But we're not getting together, all 26 plus of us. We're just not doing that this year. We didn't do it for my mom's birthday. We didn't do it for Thanksgiving. We just, you know, it's just too much risk. My dad's 90, God bless him. He's still doing good. He's walking and talking, having a good time. Don't get me wrong, he doesn't buy green bananas, but he's happy and doing good. My mom, she's 85, she's doing good too, but we just aren't putting my mom and dad at risk. That just isn't the right thing for us to do this year. So I want to throw this out that this is something that I think is really important. Try to protect your household. One of the things I want to talk about though is how do you protect your household if someone in your family has COVID? So this Christmas is going to be different for a lot of families. It's going to be people in the hospital on Christmas, and I'm sad about that. I'll tell you, as a doctor, I never really liked working on Christmas, but I had to sometimes. But I used to make it fun for my patients. But there's a lot of patients there this year. But if you have someone in your family who has COVID, one of the things you can do right now is, some of you might notice I'm wearing a different mask than I usually am. So this is a KN95 mask. It provides source control, so I protect you, but it actually gives a fair amount of protection for me from the rest of the world around me. So KN95 can actually, so I'll show you, here's what I got here today. I bought these on Amazon. They're not that expensive. They come in little packages of 5. And you know, I'm thinking if you have a COVID positive person in your house, or you think you might at some point, this would be a good thing for the person who has COVID to wear if they can, if they're comfortable wearing one, for the family to wear as well. If you have COVID, if everybody wears a mask, that's best. Now keep in mind, we do want you to isolate inside your home. If it's possible, you want to have your own bedroom, your own bathroom, if you can do that kind of thing. Not every home's set up that way. But you know, a mask inside your house is a way to protect your family. So it sounds kind of depressing what I'm talking about. Christmas sounds a little bit different, but you know, I was inspired as a kid by a Dr. Seuss book. I think you know where I'm going with this, my friends. How the Grinch Stole Christmas, right? And I just want to read you a couple lines from How the Grinch Stole Christmas, because it's a decent story, right? And I tell you, I identify with the folks of Whoville. You might have picked up on this a long time ago. I'm I'm somebody who identifies with the folks from Whoville, right? So even though the Grinch stole their presents, the ribbons, the wrappings, the tags, and the tinsel, the trimmings and the trappings, the residents of Whoville knew Christmas doesn't come from a store, it means a whole lot more. And folks, Christmas does mean a whole lot more to people. People celebrate any holiday, they mean a whole lot more. And I want to have perspective about this, right? This year it's been weird, right? A lot of depressing things have happened. There's been too much loss. Way too much bad has happened this year, but really it's just this year. I am very optimistic about our future, Rhode Island. And I tell you one thing, I think about this, like if you've ever driven your kids on a family vacation, I've done this too. My Christopher, God bless him, he's 17, but oh my gosh, even to this day, I hear, are we there yet? Are we there yet? And I think so often, you know, this feels like a vacation that just won't end. We're driving like who knows where, right? And my friends, is that we aren't there yet, but boy, we're gonna get there soon and it's gonna be awesome. And I just wanna say that is like, you know, the summer of 21, oh my gosh, folks, it's gonna be outstanding, all right? We're seeing great stuff with the vaccine. I'm so thankful for as far as we've gotten here. And so with that, I just wanna say, look, this Christmas is gonna be different, but it's gonna be setting us up for a great 2021. With that, I wanna turn over to the governor for questions, and thank you for our time together.
Question. With regard to the incident this past Friday evening, since the onset of COVID, the executive branch of Rhode Island government has largely taken near control of virtually every aspect of our reaction to this disease. And on almost a daily basis, there's been a steady drumbeat of distancing, play by the rules, don't go out if it's not necessary, and an ever-changing banquet of rules and obligations to the public. On the onset of the pause, it was made very, very clear that the situation was tenuous at best and approaching disaster. So there are a few things at question here. The spirit of the 33% rule was clearly observed at Barnaby's. The spirit, though, of unnecessary contact out of your immediate home was violated. But as importantly, and it sent a clear message to restaurants everywhere, and I'm going to quote your rules: restaurants may not operate any recreation or entertainment activities and must prevent customer access to such areas on site. That rule was thoroughly violated by the very organization that was promulgating it and creating an element of fear around the Rhode Island retail business community that I haven't seen in my lifetime. What would you say to Rhode Islanders about that?
Yeah. So as is often the case, we see things differently. You know, what I would say is I'm following the same rules as everyone else. So my rules, as I have said, stay with your household. That's what I was doing. Wear your mask. That's what we did. And follow all the rules. So that is what we've been doing. I've also been asking Rhode Islanders to shop local, which is what we were doing. So I hear you, but the rules are the rules, and I follow them just like everybody else.
Restaurants may not operate any recreation or entertainment activities.
Stefan's been through this over and over. There was no violation of the rule that night, and he'd be happy to talk to you offline about that. Brian.
Governor, on schools, last week you were pretty harsh again on the schools that were going to distance learning. In the days leading up to that and the days since, more and more have done more distance learning for the holidays, after the holidays, and then as you just said, RIDE came out with the new rules that say there can be more of that. So in hindsight, do you think you were too tough and not being fair, but do you think it hurts the productivity of the situation? Have you reached out to the superintendents? Either RIDE was acknowledging they were right in seeing the writing on the wall of the staff situations and cases, or the superintendents just got ahead of it and are now driving the bus.
Yeah.
Were you too hard on them? And
I think the answer is both are true, which is to say, I believe firmly, I have from the beginning and I still do now, children need to be taught. The best place for kids to learn is in school. Schools are safe as long as we take the proper precautions. And our principle from day one has been as many kids in school as long as possible. And listen, most superintendents, they're all working like crazy and doing their best. I have not made a secret of the fact that in certain places, Pawtucket, Warwick, I have been disappointed. I think they could have done better. Having said that, the majority of kids have been in school the majority of time. what we did in partnership with superintendents, and yes, I reached out to them, and yes, I explained that my comments were in no way intended to offend anyone or discredit all their hard work, which we're grateful for. But they said to us, over the period of the holiday, gearing up for Christmas, gearing up for school break, just like logistically, there were practical concerns around having the kids in school full time for the week of Christmas. So yeah, we listened to them. By the way, we've been listening to them the whole time, right? We have weekly Zooms with superintendents. We've been working and listening to them the whole time. So I haven't really changed my view. We want as many kids in school as much as possible. School is safe. But we also thought over the holiday, when there was a break coming up anyway, it made sense to, go virtual for a few days and then let them ramp back in January.
There's this now antagonistic relationship with the comments that you make here and what the reality is on the ground. Do you think that's hurting our relationship?
I don't think that's true. If that was perceived, there was absolutely no intention of that. And I don't think that is the case. I think the reality is we have worked together very well. They've asked for ramped up testing. We're going to be delivering on that. Our K-12 testing system is really best of class in America. We're pushing out 6,000 HEPA filters because we've heard from them that's what they want. So yes, there's been some tense moments, but by and large, we've worked hand in glove, and the majority of kids have been in school as much as possible. What I would say is this: I kind of feel hopeful that now we've moved to a place where the discussion is, we're no longer asking, should kids be in school? We're kind of have edged to a place of saying, yes, they ought to be in school. How do we keep them in school?
Governor, you've credited the pause with helping stabilize our situation right now. What would you say to somebody who's concerned that we're now opening up too quickly and that we're going to be right back in the same situation, especially when it's still really fragile? We've still had over 5% positivity a lot of days, still had more than 50 new hospitalizations a day, which have been the benchmark for reopening.
Yeah. So listen, we are definitely not out of the woods, and I hear that concern. I would say that's exactly why we're doing a phased reopening. So on Monday, we're not going back to 100% capacity in restaurants. We're moving up to 50%. We're not going back, we're slowly reopening, which is why I put that slide up. And we'll watch it. We also have the vaccine coming online, which is going to help us. We're tripling our testing. So it is a daily thing that we'll monitor. But given where we are and the fact that, certain businesses are really suffering because we closed them, I felt it was appropriate to slowly dial it up, layer in more testing, and with the vaccine coming out.
Some experts have said that the pause rules didn't even go far enough, especially with indoor dining. Other states, other locations have closed them.
No, listen, I hear it. It's very tough to make these decisions, and you only know, like in hindsight, if they were effective. There is absolutely no one answer or one perfect answer. That's what has made this so hard to manage through, because there's this constant tension between the economy and public health, and I'm trying to balance them both. So what I chose to do was a limited duration pause, only 3 weeks, pushing out a huge stimulus, biggest one in America that we could find per capita, and then slowly reopening, along with a lot more testing. So I talk to as many experts as I can. I look at the data, I listen to the experts, and then as a team, we make a judgment call.
Bouncing off that, you've said that people ignored a lot of the Thanksgiving guidance. Why do you feel they will follow it for Christmas and these holidays coming up?
I'm hopeful that people will. A lot of people didn't ignore Thanksgiving. A lot of people did keep it to their home, or I knew a lot of people that had the Thanksgiving dinner in their garage with the garage open. So I think people, by and large, did follow the rules. I think people will, by and large, follow the rules again. The other big difference this time is go get tested, right? Like, I wasn't able to say that for Thanksgiving. We didn't have the capacity. But if you know, I hope you don't have your in-laws over or something for Christmas, but if you're going to, God, go get tested the day before and the day after. And if anybody is positive, isolate or get your KN95, like the doctor said. So that is one difference now. The testing, everybody go out and get tested next week and the week after.
I've actually heard from some restaurant owners that are concerned about the end of the pause because right now they have workers who are laid off that are getting the $200 bonus. So when the pause ends, they will not be able to supply that unemployment bonus. Is that something you'd extend, or I guess maybe this is a question for Congress, I'm not sure, who through the next phase, if you will, where you're going to 50% capacity. So those restaurants that say, hey, you know what, the numbers aren't where we're comfortable opening up again. Is that something you consider?
No, I get what you're saying. Thank you. We are on money. We've used all of our stimulus, so that is not something that's on the table. However, in the bill that is hopefully going to go through the Senate, the United States Senate, the Congress today, there is additional relief for individuals. And I call our federal delegation every single day to say, where are we? Is that happening? So I am hopeful that that is going to happen. And then that'll pick up right where ours leaves off.
And if I could ask each of the two doctors, Dr. McDonald, Dr. Chin, would you feel comfortable eating inside a restaurant? Would you take your family to eat indoors at a restaurant sometime in a couple of weeks?
My wife is such a good cook. I just want to get that right off front with you, man. But I will tell you this, she loves going out to eat. And Italian is what we enjoy. I do enjoy good cannoli. There's a lot of good Italian restaurants in Rhode Island. So, yeah, so when we go out for dinner, though, my wife lived in Italy for 2 years. We have high standards. You bet I'm comfortable going out for dinner in the next 2 weeks. And we would dine. In other words, it'd be a nice restaurant, and we would do that. And I think it's possible. You just obligated me to a meal in this week. So I guess I'm going somewhere for dinner in the next week. So how's that? Dr. Chan, I'd love to see what you say with this.
Well, I'm going to have to compliment my wife on cooking, and she is a good cook. I also love to cook, so I cooked for Thanksgiving. But I've been out to eat a few times during the pandemic, and I think it's, what I've been seeing is that it is incredibly impressive. The restaurants are adhering to physical distancing. People are masking when they're not eating. The waiters and waitresses are always masked. So I feel comfortable, and I have felt comfortable. I think the winter's a unique challenge, right? Because everything has to be pushed indoors. But I think with the spacing rules and everything I've seen, I've been reassured. So I'm comfortable.
And restaurant workers should feel comfortable, folks who are on the front lines of interfacing with multiple families throughout the course of the night based on what you each observe. Do you believe that there's no particular risk for someone who's working as a waiter right now, a waitress?
I believe the risk is minimal. I mean, again, from what I've seen is the waitresses and waiters are masked, which is fantastic. They, there's hand sanitizers and gels at these restaurants, and I see them using it and with the physical distancing as well. So we have seen some cases in restaurants, but I think if we all adhere to what we've been preaching, what the governor's been saying every week for 9 months, then I think it's going to be pretty safe.
While you're up there, can you clarify the vaccine dosage situation? Because we've heard just in the last couple of days so many different things. And initially, we heard that they were able to squeeze out more from the vials that they already have. So then where does that put us? But then we heard about the lower amount coming in with this latest shipment. Then we're hearing that Pfizer actually has those doses sitting in a warehouse. It's just a matter of the federal government distributing it properly. What's the actual situation with that?
Yeah, it's a great question. So I think what you're alluding to here is that there's so many unknowns and things we're hearing about every day. And that's one thing that's made it really tough about vaccine implementation. I think to your point about the vaccine doses, every time a physician, a clinic, a nurse gets a vial of medication, there's a certain number in that vial. And what people have realized with the Pfizer vaccine, is that it's been reported that there's 5 doses in there. Well, there's actually 6 or even 7 in there. And in normal world times, non-pandemic, other diseases, those last couple doses, those remnant doses aren't always used. But because of the shortages of the vaccine, obviously the demand is that we want to make every single dose count. And so it was actually very reassuring and exciting to hear that there were potentially 2 extra doses per vial of vaccine. So that's been endorsed now by the FDA that you can do that. You can get 6 or 7. So that's, you know, if you think about it, from a dose of 7 compared to 5, that's almost 20% more, right? So that's good news for sure.
I have a question about testing at schools, either the doctor or governor. Aren't rapid tests more accurate on people with symptoms? And so why are you using them for the asymptomatic K-12 testing system?
Yeah, it's a great question. So we do know that the rapid point of care tests are more sensitive. And if you look at what the FDA and the guidance that they've released, they are more sensitive in people that are symptomatic. We have hundreds of thousands of Binax tests at the moment, and they are certainly accurate to some degree, not quite as good as symptomatic people, but they are really good as well in people that are asymptomatic. I think the other key point to remember about this too is that these antigen-based tests are going to pick up people who are actively shedding virus as well. So it may miss some people who have lower level infection, but the people that they are picking up are people that are actively shedding, are most likely to transmit, et cetera. So we've talked to experts, we've talked to our testing and validation task force, and they all agree with this approach and think it's reasonable, and it's a great way to get testing out there.
Governor, the Department of Health released a study paper a couple weeks ago that's showing that in the first 6 months of 2020, fatal overdoses on drugs are up almost 26%, and opioid-involved overdose deaths are up almost 33%. What's the state's plan to handle overdoses during the last months of the pandemic?
Yeah. So what you say is correct, and it's beyond heartbreaking. We have been fighting the opioid pandemic and crisis for the past years, and it's gotten so much worse during COVID because people are isolated. Mental illness, depression is through the roof. People are isolated, they're alone. It's also been hard to go see a therapist, go get your treatment, get to the doctor's office. So a few things. Again, as I was saying earlier, in the current bill that is on path to pass in Congress, there is a good chunk of money for addiction. And we would put that to work immediately to increase our efforts to help folks struggling with opioid addiction. So what does that look like? Continued medical assisted treatment in the prison, more medical assisted treatment in the community, a lot more outreach, a lot more in the community, peer recovery coaches, street workers in the community there. Continued use of telemedicine. So we have required actually, telemedicine to be covered equal to in-person visits. One of the areas that is extremely helpful for is, visiting a therapist. So we would look to continue that and maybe expand that. So I think the short answer is it's horrible. I'm I guess proud of the fact that Rhode Island is recognized as a leader in America for the work we've done around overdose. And we are just it's a very top priority in the new year as we focus on it. The last thing I'll say is, I think we need to be more aggressive in launching a recovery-friendly workplace initiative, because having a job is key to being able to sustain your recovery. But in this job market, it's hard for anyone to get a job. And if you have had addiction or you've spent time in prison due to having had an addiction, we got to be right there for you. So the Back to Work initiative that I've launched, we are focusing on people who are struggling with addiction to get them a job. So anyway, it's a complex topic, all of which is to say we are on top of it and we need to do more.
Governor, you obviously put a lot of emphasis on increased testing. And a couple of questions here about why is this, possible now? Who's going to be doing those tests? Is that statewide? And then also you mentioned that the pop-up tests would start as of Sunday. And in your list, I believe you mentioned gyms. Would they be opening on Sunday or Monday at the end of the pause?
Okay. So the gyms can open on Monday. When I was saying Sunday, I was referring to malls, grocery stores, Roger Williams Zoo. I really just didn't want people to be surprised if they're going to go out to Garden City and do some Christmas shopping and they see a pop-up test. That's like an official thing, and it's safe, and you should go ahead and if you see it tomorrow or Sunday. We're going to be layering them in over the coming days. But no, the pause lifts Monday, so gyms will be open on Monday.
The gym will go to the customers of the gyms themselves, so those aren't open.
Right, yeah. So he's saying if you go to the gym on Monday, it's for the customer of the gym. I'm sorry, what was your other question?
The other question is, who's going to be doing?
Oh, who does the
tests?
testing? Thank you. Oh, you asked, how do we get the supply? Yeah. So most of what I'm announcing now at supermarkets, malls, et cetera, are these Binax kits. They are the ones that Dr. Alexander Scott showed the other day. So it's, you don't need any equipment. You can do it yourself. Really, you can do it yourself. You swab yourself, you put it in the cardboard, you close it, and you let it sit there 15 minutes. So I actually went to the federal government and asked for a lot of them. Dr. Birx was terrific. I appealed directly to her when we started to get into trouble, and we asked for an outside shipment, and they have delivered. So now we have a pretty good stockpile in Rhode Island of, like at this point, over 100,000 of those tests in our possession, and we're looking to get them out. The National Guard is going to be heavily deployed to do this. We're hiring people, temporary workers, Department of Health. And again, it's pretty simple. We're also doing like a train the trainer model. So the Guard will, if let's say you wanted to do it at your, I don't know, at school, we're going to be teaching people how to do it because it's really very simple.
Follow up on the school testing. How do you envision people either signing up, or is it people just going to come through a line? It's going to have to be parental consent for this on-site school testing?
So there's two ways that we're going to do it. One, and this is why we went to the superintendents and we asked them, which do you want to do? One way is they say we want a testing event. So like next Tuesday, we're going to have a big event and test everybody. So yeah, parents would be notified, teachers would be notified. We would send people to the school on that day and test everybody. The other way is like a cyclical thing, a random testing of a sample every 10 days. And same thing, yeah, no one will be forced ever. No one's ever going to be forced. We will ask. Teacher says no, we respect that. Parent says no, we respect that. But for everyone who says yes, we'll do it on site. And again, over time, we're hoping to get the schools to be more and more independent, to just kind of do it on their own. Have a good weekend.